What's up guys? Welcome back to my YouTube page. My name is Omar, aka Daher Radiology, and today we're going to start a series of videos on a question that you've been asking me a lot about on the subspecialties of radiology and diving a little bit deeper into each of those. Starting out today, we're going to be doing abdominal imaging. So let's get started. Alright guys, so in this series of videos, we're going to talk about the different subspecialties in radiology. And we're going to delve a little bit deeper into each of those subspecialties and what they have to offer. I know this is a very unknown topic to a lot of you, and you wanted to have more information in making a decision during your radiology residency, and something that you'll practice for the rest of your life. So here's my attempt at trying to give a brief overview of some of the subspecialties that are offered out there. And starting off today, we're going to be doing abdominal radiology. So in abdominal fellowship, there will be advanced imaging techniques for all modalities, primarily targeting the organs within the chest, abdomen, and pelvis. In most radiology fellowships, the chest and the abdomen pelvis are now separated into two separate fellowships, body being the abdomen pelvis, whereas chest and cardiac being the chest. There are still some places that offer the chest, abdomen, pelvis during your abdominal fellowship. However, for the sake and purpose of this video, we're going to be talking about the abdomen and pelvis body fellowship focus. So that being said, all of the modalities that are used within the abdominal radiology subspecialty are the ones that you've heard of before. So there's X-rays, ultrasound, CT, MRI. The use of these modalities are focused within the organs of the abdomen and pelvis. So that leaves us on to the different body parts that would be imaged in an abdominal fellowship. The focus is going to be primarily on the liver, pancreas, spleen, kidneys, bladder, pelvic structures, any type of intraperitoneal or intra-abdominal process, as well as biliary tract and gallbladder. In the world of abdominal fellowship, a lot of the things that are found within the abdomen that are characterized on ultrasound or not definitive on CT can be further worked up, especially with MRI, and characteristics can give us information as to what that might be. So for example, when doing ultrasound of the liver, there may be a hypoechoic lesion or a hyperechoic lesion. And while it may fit the properties of one lesion versus another, sometimes they're just not textbook. So advancing the modality in the CT world or in the MRI world, that you can gain more information with further characterization and be more confident if this lesion is actually a benign lesion or a malignant lesion, something that you need to do something with or just follow or excise right away. And so this becomes very useful in knowing signal characteristics and information about different types of lesions within different types of organ systems. A prime example of that would be in a patient with multiple comorbidities, and a prime example would be in a cirrhotic liver. So a cirrhotic liver is one that's predisposed to HCC, an aggressive type of tumor of the liver that needs to be dealt with, and treatment bases depending on its grade and its staging. And so if you were to find a lesion within a cirrhotic liver patient that's not really characteristic of an HCC, but something that you can't really put your thumb over, you may have to do further imaging to figure out, is this something that's cancerous that we need to worry about, or is this something that's benign that we don't need to worry at all? And so that becomes very helpful when differentiating between a lesion that's benign versus malignant, especially in a case where it's not clear. The expertise within a fellowship usually come between knowing the differences between different characteristics of lesions in the different types of modalities. And you become an expert at being able to differentiate using the type of cellularity within the lesion, such as diffusion-weighted imaging, contrast and the patterns of contrast enhancement when using gadolinium, different types of contrast enhancements using primavist versus gadolinium versus other types of contrast enhancements. And this really applies to all of the abdominal organs within the body. You really become an expert in the oncologic processes of those organs as well, and the staging of those processes from the abdomen to the MRCPs, which look at the biliary ducts and drainage, to the MR rectums, which look at colorectal cancer, and as well as knowing really the characteristics of where these things metastasize. So we've kind of touched on a brief basis about what types of organs and body imaging that there is within an abdominal fellowship. The next part I want to go into are some of the procedures that an abdominal radiologist might perform on a daily basis. I know a lot of you are interested in that kind of thing, the different types of procedures that happen in each of the subspecialties. So within the abdominal radiology world, there are a multitude of procedures that can happen, really depending on your training and what you've done in your training site. However, in general, things like biopsies are a huge category of the abdominal procedures, as well as drainages. So with biopsies, almost any organ is capable of growing a tumor, and in a lot of cases a mass that's undifferentiated and really the characteristics aren't known. The pathology is needed to help treat that mass, and for the oncology team and the surgeons to know what they're dealing with and what management is appropriate for that patient. So liver biopsies, kidney biopsies, a whole bunch of types of biopsies that happen within the body itself are guided by our body fellowships. That's the use of ultrasound-guided biopsy, CT-guided biopsy. These vary from transrectal prostate biopsies all the way to just simple liver biopsy, random liver biopsy. And so all of these types of biopsies are crucial in the treatment of a patient and getting pathology of what's needed to move forward. Within the body fellowship world, there is some expectation of drainage processes. So, some types of superficial drainages that are comfortable, outside of the realm of interventional radiology, where you could be draining an abscess, and these are very commonly done by body radiologists. So all in all, the pros and the cons of doing a body fellowship. The pros of body fellowship, and what a lot of people will say, is that in their residency they feel like they've gotten a lot of exposure to body imaging, and so it's not a foreign concept to them when starting out in fellowship. Yes, there's quite a bit more to learn in fellowship. However, the guiding principles are kind of foundational for you, that you started out in your residency, and you kind of just build upon that. As well as a lot of people think it's more intuitive, in the sense that you've seen all of these pathologies before and you're kind of just becoming an expert at differentiating them, and also learning more advanced techniques for staging things like cancer, for example. Another pro is that body radiologists have a wide scope of practice, so they feel as though they're more general, and so they have a whole multitude of pathologies. The availability of jobs for an abdominal radiologist varies on where you're from. However, it is one of the most generalized fellowships, so if you're looking for something that might fit in any scenario, then that would be one to consider, since it's both academic and community based. Some of the cons about abdominal radiology fellowships would probably be the fact that abdominal radiology is the forefront of what we see on call, and then you're probably going to be a part of the larger pool of call for your center in terms of after-hour operations, if that's what your center offers. Another one of the cons that one might consider about abdominal fellowships would be that it's quite a large breadth of information to know. There are so many different organs within the abdominal and pelvic system that there are just so many different types of cancers and pathologies that are expected of an abdominal radiologist, so there's constantly going to be changes in the literature. Another one of the cons of potentially doing an abdominal fellowship, abdominal radiology definitely comes with a lot of oncology, so you definitely have to be okay with a lot of cancer type reporting. Given that you actually will also be doing quite a bit of tumor boards, and so you have to be quite comfortable performing tumor board reviews where the surgeons and the pathology and the oncology teams round out and basically present each case. Usually it's an oncologic case, of course, and it's discussed at large to see what kind of management will be done for that patient. The last thing I wanted to talk about would be the types of billing in the world of an abdominal fellowship radiologist, I should say. And really I'm going to keep this broad as well, but the way that I describe how the billing would work for a subspecialty radiology would be to think about how much specific types of scans they're doing. So if you think about the amount of MR scans that a body radiologist would do, I would say they do an average amount. And an average amount of MR is going to equate financially on an average level. There is going to be quite a high volume of CT scans, a lot of which are screening scans that are looking for metastases or staging of a disease. So there's going to be high output volume in that sense. And then there's also going to be quite a bit of ultrasound, which doesn't remunerate a lot, but is something that you as an abdominal radiologist will be doing quite a bit of. Alright guys, I hope you've enjoyed this video on the brief overview of abdominal fellowship. If you liked it, please remember to like and subscribe. I'm quite grateful for the community that we've started to build here. And don't forget to follow me on Instagram, Daher Radiology. It's where a lot of my cases are shared on a day-to-day basis, and we'll have some fun over there. So until next time guys, we'll do another video on another subspecialty. So if you have one that you want done sooner than later, leave me a comment down below and we'll see you in the next one.